Hello, today I'll be presenting to you briefly about the importance of risk assessment for surgical pressure injury prevention. I am Gerry currently working as the Director of Clinical Education and Professional Practice in one of the hospitals here in Southern California. I also support as an advisor to the Perioperative Nurse Educator Council within the 17 hospitals of Providence Health across California. I am a certified perioperative nurse, ambulatory surgery nurse, surgical service manager, nursing professional development specialist, and certified professional in healthcare quality. I'm the current vice president and secretary of ARN in Los Angeles, California, and also a member of the nominating committee for the ARN National. Just to share with you briefly my location, I am at the west side of Los Angeles County by the famous Santa Monica Pier, few miles away from Los Angeles International Airport. I have no conflict of interest while presenting this, and these are my objectives. Pressure injuries are also known as the pressure ulcers or bed sores can occur in patients undergoing surgery or during the perioperative period, the period before, during, and immediately after surgery. These injuries can be caused by sustained pressure or friction on the skin leading to tissue damage. Here are some general statistics related to perioperative pressure injuries. The incidence of perioperative pressure injuries varies depending on the population and the definition used. A study published in the Journal of Clinical Nursing reported an overall incidence of 3.2% for surgical patients developing pressure injuries. And according to the Agency for Healthcare Research and Quality, there are 2.5 million patients affected by pressure injury per year. Several factors can increase the risk of developing perioperative pressure injuries, including advanced age, immobility, obesity, malnutrition, comorbidities such as diabetes, peripheral vascular disease, and prolonged surgical procedures. The most common areas where perioperative pressure injuries occur are the sacrum or your lower back, heels, and buttocks. However, injuries can develop in any area of the body that experiences sustained pressure or friction. Pressure injuries in surgical patients can lead to an increase in length of stay, in hospital length of stay. A study published in the Journal of Wound Care found that surgical patients who developed pressure injuries had a longer average length of stay compared to those without pressure injuries, 19.6 days versus 12.4. Pressure injuries also have economic implications. They can increase healthcare costs due to the prolonged hospitalization, specialized wound care, uh, and additional treatment. One study estimated that the average cost per pressure injury in the United States ranged from $20,000 to $150,000 or 9.1 to 11.6 billion per year. More than 17,000 lawsuits are related to pressure injury annually. It is the most common claim after wrongful death and greater than false or emotional distress. And around 60,000 patients die as a direct result of pressure ulcer each year. The Center for Medicare and Medicaid Services has guidelines and regulations related to perioperative pressure injuries. CMS has established the following guidelines and regulations. Hospital Acquired Condition Hack Program. Under this program, CMS has identified hospital-acquired pressure injuries as one of the conditions for which hospital may face financial penalties. Hospitals are expected to prevent pressure injuries and provide appropriate care to avoid their occurrence during patient hospital stay. The value-based purchasing program incentivizes hospitals to improve quality and patient outcomes. In this program, hospital performance is assessed based on various measures, including incidence of hospital-acquired pressure injuries. Hospitals with lower rates of pressure injuries may be eligible for higher reimbursement. Although not specific to pressure injuries, CMS has regulation and guidelines related to surgical site infection. Proper wound care and infection prevention practices during the perioperative period are essential to reduce the risk of both surgical site infection and pressure injuries. CMS requires accurate and thorough documentation of pressure injuries and their stages. Hospitals are expected to follow standardized staging system, such as the National Pressure Ulcer Advisory Panel staging system, to ensure consistent reporting and monitoring of pressure injuries. And lastly, CMS encourages hospitals to implement quality improvement initiatives to prevent perioperative pressure injuries. This may include staff education, risk assessment protocols, pressure injury prevention guidelines, and the use of evidence-based practices to reduce the occurrence of pressure injuries during the perioperative period. Perioperative pressure injury assessment is crucial for several reasons. Assessing a patient risk for developing uh, pressure injuries help implementing preventive measures. By identifying high-risk individuals, healthcare providers can take proactive steps to minimize the risk factors and implement appropriate preventive strategies. This can significantly reduce the occurrence of pressure injuries. Pressure injuries can lead to pain, discomfort, and potential complications for patients. By conducting risk assessment and implementing preventive measures, healthcare providers aim to ensure patient safety and prevent avoidable harm. Assessing and addressing pressure injury risks to contribute overall patients' well-being and satisfaction. Pressure injuries can result in increased healthcare costs due to prolonged hospital stays, additional treatment, and specialized wound care. By identifying and managing perioperative pressure injury risks early on, healthcare providers can potentially reduce the occurrence of these injuries, leading to cost saving for healthcare system and patient. Risk assessment is an integral part of providing high-quality perioperative care. It enables healthcare providers to tailor intervention intervention specifically to individuals' patients' need. By addressing pressure injury risks, healthcare providers can enhance the quality of care delivered, promoting positive patient outcomes. And lastly, healthcare organizations are increasingly held accountable for patient safety and quality of care. Implementing a comprehensive risk assessment protocol for perioperative pressure injuries help healthcare providers meet legal and regulatory requirements. It ensures adherence to standards and guidelines set forth by governing bodies, enhancing compliance and mitigating legal risks. Other impact to the patient is that patient may develop pain, loss of work, financial burden, increased hospital stay, readmission or reoperation, emotional strain, and decreased quality of life. Providing staff with the right resources, including proper education, is essential in preventing perioperative injuries. Proper education equips staff with the knowledge and awareness necessary to identify and understand the risk factors, causes, and prevention strategies for perioperative pressure injuries. It helps them recognize the importance of early intervention, assessment, and implementing preventive measures. With this knowledge, staff can be proactive in identifying high-risk patients, implementing appropriate preventive interventions. Education ensures that staff is familiar with evidence-based practices and guidelines for preventing perioperative injuries. These include understanding proper positioning techniques, frequent repositioning, pressure redistribution surfaces, use of supportive devices, and early detection of pressure injuries. Education empowers staff to apply the latest research and best practices in their clinical practice, leading to improved patient outcomes. Also, education provides an opportunity for staff to develop the necessary skills to assess and manage pressure injury risks effectively. This includes learning how to conduct comprehensive risk assessment, identify high-risk patients, and develop individualized care plans. By building these skills, staff can effectively implement preventive measures and take appropriate actions in response to changing patients' needs. Proper education promotes interdisciplinary collaboration among healthcare professionals involved in perioperative care. It enables effective communication and teamwork between surgeons, anesthesiologists, nurses, wound care specialists, and other healthcare providers. Education is not a one-time event, but an ongoing process. Staff should receive regular updates and refreshers training to stay up to date with the latest advancement and evidence-based practices in preventing perioperative pressure injuries. Continuing education promotes a culture of learning and improvement, This enables staff to adapt to new research findings and enhance their skills and knowledge over time. Providing staff with the right equipment resources is crucial for preventing perioperative pressure injuries. The use of appropriate pressure redistribution surfaces such as specialized mattress, cushion, and overlays is essential in preventing pressure injuries. These surfaces help redistribute pressure evenly, reduce friction and shear forces, and minimize the risk of developing pressure injuries. Providing staff with access to these surfaces ensures that the patient are adequately supported and protected during surgery and throughout the perioperative period. Proper positioning plays a crucial role in preventing pressure injuries. Staff should have access to positioning devices and tools such as foam or gel, positioning pads, pillow wedges to facilitate optimal patient positioning. These devices help in relieving pressure from vulnerable areas, maintaining proper alignment, and reducing the risk of pressure injuries. In certain cases, protective dressings and barriers a barrier product may be required to protect at-risk areas from friction, moisture, and shear forces. Staff should have access to appropriate dressings such as silicone or foam dressings and barrier creams or film to provide an additional layer of protection for vulnerable skin. This product helps prevent skin breakdown and reduce the risk of developing pressure injuries. Various supportive equipment can aid in the prevention of perioperative pressure injuries. These include pressure relief or alternating air mattress, lower loss bed, heel protectors, and elbow or head protectors. Providing staff with access to these supportive equipment ensures that they can implement appropriate measures to relieve pressures on vulnerable areas and prevent pressure injuries. And lastly, staff should have access to reliable risk assessment tools and documentation system to assess and document a patient at risk for developing pressure injuries. These tools help identify patient at risk and guide the implementation of appropriate measures. Accessible and user-friendly documentation system enable staff to accurately record and track pressure injury risk assessment, intervention, and outcomes. And these are my references. And now I'll leave it to you on reassessing your workplace and see what available resources you can have in order to prevent pressure injury for your patient. Obrigado. Thank you.